All righty, we're live. Hello, everyone. This is the Kiltz Health live stream with Dr. Nelson, and I am your host, Dr. Nelson. Thank you for being here. You can put in the chat where you're watching from, and I am in Central Florida. Where are you, Dr. Hockings?
Dallas, Texas.
Excellent. Okay. So before I start, I want to read something. This live stream is for educational and informational purposes only. The contents are not intended to be a substitute for professional medical advice, diagnosis, or treatment. Even though you will be hearing from two physicians here, we're not your doctor. You're not our patient. So, like I said, this is for informational and even entertainment purposes. Always seek the advice of your personal physician or other qualified health provider with any questions you may have regarding a medical condition. All righty. So, here we go. As a founder of Diabetes Reversal Group, Dr. Jeffrey Hockings leverages 35 years of functional medicine expertise to help patients reverse type 2 diabetes, which is a subject very close to my heart. His patented evidence-based telehealth protocols focus on root cause healing and medication reduction. Discover how he is transforming metabolic health at diabetesreversalgroup.com. Diabetesreversalgroup.com. So, welcome to Kiltz Health, our live stream today. I'm going to give you a chance to tell us who you are, tell us a little bit about you personally. And I thought I had your page open here, but go ahead and tell us about yourself and what you're doing in trying to improve health and wellness around the world.
Yeah, so I'm, again, Dr. Jeff Hockings. I've been in healthcare for 35 years now. First 18 years, my wife and I, we built and sold 4 wellness centers in Southern California, kind of pain management wellness centers with chiropractors, medical doctors working together. And after 18 years of that, we decided to shift gears and tackle type 2 diabetes because it runs in our family. I had an aunt who died of it. My wife's dad passed away from it. So it's a personal mission for us, Doc, to get this word out to as many diabetics as possible that this disease is reversible. And so we started it back in 2009. And after 9 years of kind of trying to crack the code on putting together a protocol that could predictably reverse type 2, we finally cracked the code. And that's when we applied for our patent back in 2017. Took us 3.5 years to get patent approval. We got that in 2020. So now we have the distinction of having the only patented system in the world that reverses type 2 diabetes. So very, very exciting. We're telemedicine. We expanded into India a couple of weeks ago. We're going into other countries. And now it's just a matter of how do we get this in front of millions and millions of diabetics? Because, you know, there's 38 million diabetics in the U.S. and we have the solution. So it's a pretty exciting time for us.
All righty. So please put in the chat if you have any questions for Dr. Hockings or for me. Put it with a QQQ in front if it's possible so I don't miss it. We're in multiple platforms streaming right now. So some of them actually won't show up here, but I'll take a quick look at Instagram whenever I have a chance, because we might have people from Instagram as well. And welcome, Rick. I know you were here early. Noslo, Cheryl Camp, Paul Clark, George Goodenough, Cheryl, North Dakota Carnivore Lands, Bacon Runner, Sandy, hope the baby's doing okay. I mean, Cheryl, and hope the baby's doing okay. Anyways, put your questions in the chat. Let me know where you're watching from. And let's start with an easy one. It's easy, but depending on the metabolic framework you're coming from sometimes. What causes diabetes?
Well, in my experience, Doc, it's insulin resistance. And it's an adult onset disease, and it's not a genetic condition. And that's a good news, because that means even if everybody in your family has type 2 diabetes, it's still a reversible condition when you change your lifestyle. And that's the great news, because a lot of physicians, as you know, they're trained to just manage diabetes with meds. And it takes the hope away from a diabetic, where they think they get diagnosed and they got to live with this thing the rest of their life. There's nothing they can do except take a never-ending cocktail of medications to manage it. And now, again, with what we're doing, there's a solution. So that's the exciting thing about what's going on right now, is that there is a solution for this, and there is hope for people that are type 2 diabetic.
So I agree with you, and I frequently use the term insulin insensitivity rather than insulin resistance, but that's another a topic for another day. But I agree with you. However, what causes insulin resistance?
Yeah, well, again, multiple things. It can be being overweight, eating too many carbs, too many sugars. And because of that, it bombards your system with so much glucose that now your pancreas is just putting out a never-ending supply of high insulin to try and bring that blood sugar down. And that's what can eventually lead to the resistance, where it's almost like an autoimmune disease, where now the insulin can't grab a hold of the glucose and pull it out of the bloodstream into your cells for energy. It gets stuck in the bloodstream, and that's what leads to the blood sugar staying high. So that's kind of what happens. And so now when you reverse that process, start eating better foods, exercising more, taking the right supplements, all of a sudden it can reverse that insulin resistant process. And that's what we see. So as you know, Doc, it's not for type 2 diabetics, it's not an issue with is the pancreas producing enough insulin. It's the body's not utilizing the insulin effectively, and that's the issue. So it's obviously totally different than type 1, where it is an issue where there's not enough insulin being produced.
So sometimes we go to the doctor and we start having some abnormal blood tests, and the doctor tells us at some point, oh, you have diabetes.
Yep.
When do you think the process started? Did it start that week, that month, 10 years, 20 years ago?
Depends on the person, Doc. There's really no way of knowing that, right? If you're feeling pretty good, and if someone's getting labs done every single year, which they should as a minimum, right? Get some blood work done. You'll see if there's some high blood sugar, if the A1C is high. So as long as someone's getting blood work done on a regular basis, they're going to catch it pretty quickly. So it's not like it's going to be a 10-year process where they've had it and just didn't know about it for most people. Because again, if it gets significant enough, you'll start feeling some symptoms, right? Increased urination, maybe some neuropathy, some blurred vision, et cetera. And so again, so the answer to your question is it depends, right? It's hard to kind of judge. When someone gets diagnosed, it's very hard to tell, like, hey, did they have this for a year? Was it 3 weeks? Was it 6 months? Was it 10 years? It depends on the actual situation. So
my question was more to this aspect. Yes, the diagnosis of diabetes based on 4 different diagnostic criteria, you can be having for years labs and not show that you have diabetes, and all of a sudden you do. But I was talking about the process of insulin resistance and hyperinsulinemia that can start in some studies as far back as 20 years before. So sometimes we do have clues, and we don't pay attention to it as physicians. Most of my career, I've been a physician for 41 years. Most of the time, I two, waited until the patient had diabetes, and then I became great at managing. I was so upset with myself when I, doing some more studying, realized, okay, wait a second, I could have reversed at least half or three quarters or more of my patients with diabetes. I do have more questions, but let's go ahead and take a question here. Paul Clark is asking, what is a normal glucose reading? Mine is always 110 to 125. Is that high? He's been carnivore for 3 years.
Mm-hmm. Do you want me to answer or you want to answer?
It's for you, yes.
Okay, well, the follow-up question to that is 110 to 125, is that on medications or off medications? Big difference.
I'm going to take a stab and say that this is probably off medication, but let's take both scenarios. I mean, we're here to educate.
Yeah, so if he's still taking medications, then the blood sugar is kind of irrelevant, right? Because whatever it is, it's an artificial reading, because the blood sugar meds will bring that blood sugar down artificially. So now, if he's not taking meds, that's pretty close to normal. Again, I always laugh about this, and you've probably seen this too, Doc, in your career, how the normals on labs have changed. When I got out of school 35 years ago, it was normal blood sugar to be 120 or less. Between 80 and 120 was normal. Then all of a sudden, magically, about 12, 13 years ago, it had to be under 100 was normal. So now if you're 100 to 120, oh my gosh, that's not good. And he kind of did the same thing with cholesterol. When I got out of school, normal cholesterol was 250 or below. And then magically they changed the normals, and now you got to be under 200 for normal cholesterol. So that's why I'm still saying if it's around 120 or less fasting blood sugar with no meds, then in my opinion, my experience, that's pretty good. So,
and I'll tell you how crazy that statement is, which is true. Things change over the years, and sometimes the reasoning is solid. Sometimes the reasoning has to do with we're trying to diagnose more of something so we can treat it with this other thing that we will sell to you.
Exactly.
But when I started medical school 45 years ago, and at that time nobody would bat an eye until the blood sugar was beyond 140 fasting. Okay,
Sure.
140 was the key number at the time. Then it went down to 126, and of course, now it's under 100. Now there are some good reasons with that, because when you compare those numbers to what the equivalent A1C is, we always go down to that 5.6% in the A1C. And some studies have shown that once you go past the 5.6, your risks of heart attack, strokes, and cancer and all-cause mortality start increasing at that point. So, there might be some solid academic reasons for using those numbers, but certainly the other reason, it's always there as well.
Yeah, in my experience, again, if we see someone who's got an A1C of 5.9 or lower, taking no diabetic meds, we've never seen any issue. I get it. So we're talking about the functional range. I know the labs now say they like to have it below 5.6. Then you look at the A1C for that, or the blood sugar number for that. Now you're looking at below 100. Is that real? So it starts getting to the point of, okay, back to what we said before, where they've changed the normals. And of course, now when you lower what the normal is, now there's way more people outside of that now, guess what? They need medications. It's magical how that happens, right?
Absolutely. All right. So Charlene ask, how about this drug? How long will you take it? And are the exceptions to taking there? Are there is exceptions to taking this? Lifestyle should be the best option. Why should someone take a drug for this? I don't know what drug you're asking for, but let's just generalize it. If you're taking anything for diabetes, how long should you take it? Are there exceptions? And is lifestyle the best option? And why should someone take a drug for this?
Yeah. So again, in my opinion, I think there's zero reason that someone who's a type 2 diabetic should ever have to take a diabetic med if they're willing to change your lifestyle. So that's the disclaimer, right? If you're not going to do a program like ours or like you teach, doc, then it's a good thing the diabetic meds are there, because they need to take those to keep that blood sugar in that normal kind of healthy range. But just because I said that, that doesn't mean that you have to keep taking them, because there is an option. So that's what I want to make sure people understand, is that you can change your lifestyle to the point where your doctor will be able to wean you off your diabetic meds, but you have to be willing to follow the right program. So we're not saying, hey, just go throw all your diabetic meds in the trash. It's only if you start, the blood sugar starts gradually coming down, and then your physician can start gradually weaning you off your diabetic meds when there's objective evidence saying that it's okay to do that. Like if your blood sugar is 160, they're not going to reduce one of your meds. It gets down to 100, yeah, they can cut one of your meds. So that's what we have to make sure happens.
Yeah. And again, you need to always be working with your provider when you're decreasing medications.
100%.
This is a potentially serious condition. I say it is serious because if you continue with high blood sugars, your chances of multiple catastrophic events, strokes or heart attacks being some of them, some other that show up later, that renal failure, circulatory problems, amputations, retinopathy, and things like that, is going to continue to increase. The answer, medicines will be necessary as a temporary stopgap, is what I would say. You need to change your lifestyle, and this is what we're talking about today, but certainly work with your provider. So if you're on medication, someone's prescribing them to you. Now, you might want to work with someone who's willing to work with you in reversing your diabetes. And I thought I was going to present this later, but let's bring this up now because this is based on a study. Let me take this out. And rapid and profound results. And this is what I have seen. I didn't ask you before we were backstage talking, but I'm sure you've seen similar situations where
For
based
16
on this
years, we've
particular,
seen it. Yeah.
I'm sorry?
Yeah, we've seen these results with our patients for 16 years. That's what we do.
Yeah.
So,
Yeah. So 95% in that particular study of insulin users either reduced or eliminated usage completely. 100% of sulfonylureas discontinued them. A1C went from 8.9 to 5.6. You were uncontrolled diabetes. 3 months later, you can be completely normal. You don't have diabetes anymore. Because the diagnosis of diabetes is basically elevated blood sugar. And there are 4 different criteria, diagnostic criteria, but they all end up in the same place. If your blood sugars are this high or remain this high, you have diabetes. And you can reverse diabetes in as little as 3 months. Does it happen for everyone after 3 months? Probably not. But anyways, and then your triglycerides go down, your HDL goes up, and all those are good things. And someone just asked a pertinent question because I'm mentioning triglycerides and HDL. So let's take that. Let's remove this. obviously you must, if you're using a keto, paleo, carnivore diet, there's always the question about cholesterol. So, of course, it has come up right now. What about someone with naturally high cholesterol?
Yeah. So what is naturally high? That's the question. So what is it? Because there's definitely some misinformation out there as far as what's normal cholesterol versus what is. And again, that was one of the examples I gave you when I got out of school. It was less than 250 was normal. Now they're saying less than 200. And as you've seen, Doc, the craziest thing with cholesterol on the labs, it doesn't even say normal cholesterol between 100 and 200. It just has a less than sign in front of the 200. So you could have cholesterol of 50 and your doctor's like, yep, that's good. That's like saying like your blood sugar 50 is okay instead of having a normal range. So it's very, very odd, the whole cholesterol issue. But yeah, I'd love to hear what the cholesterol level is to where they consider that high.
All right. This is not a question, but George Goodenough, who is in the United Kingdom watching right now, my hemoglobin A1C dropped from 6.7 to 5.4 in 5 months. No medication, no help from any doctor. And I'm sure you've seen this over and over the years, right?
Yep. Thousands of times. Yep.
All right. Cookie Carter, does time restricting eating helps to lower blood sugar on a low carb diet?
Yeah. So again, it's like a low carb diet is good. You got to watch what kind of carbs too, because there's different ones, right? You get carbs from fruits and vegetables. Those are better carbs than grains from like pasta, rice, cereal, potatoes, pizza, chips, all of that. So that's what I see as far as that's why what I eat myself is more of a paleo, combination of paleo plus carnivore. And I do intermittent fasting myself every day. So last meal is about 6 o'clock at night. I don't eat again until noon. So I just have lunch and I have dinner and that's all I have. Again, I'm 61 years old. My labs are normal, take no medications. And so again, very little of the bad carbs do I have in my diet. I do have some fruits and vegetables, but it's mainly protein is what I'll have as far as the majority of what I eat per day.
So you do time restricted eating. After 6, you don't eat, and you don't eat until 12 the next day?
Yeah, till noon, yeah.
So you're doing 16-8 kind of protocol. Okay.
Yep. Again, that works for me, but I've tried a bunch of different things, and that just seems to work for me. I keep the same weight, been the same weight for about 12 years now. I'm about 6'2", 210, again, work out 5 days a week. Labs are normal, no meds. I'm 61. And so I've kind of found my sweet spot that works really well for me. But yeah, so I don't think you need to be eating breakfast, lunch, dinner, and you're satisfied. Again, everyone's kind of different with that. You got to kind of play around with it, but that's what works for me as a 61-year-old man that's very active. And I'm never hungry in the morning. I don't miss breakfast, and I'm not starving when noon comes along. So that's what's interesting. My wife taught me this a long time ago, Doc, when this is about 15 years ago, and we're watching a movie, and I had this like bowl of cashews next to me. And so instead of popcorn, I would eat cashews, right? That was my go-to snack. And after about 10 minutes, she saw me like eating it like it was popcorn, and she kind of elbowed me and said, "Are you even hungry anymore?" And I'm like, I thought about it. I'm like, no, I'm not hungry. So it was really kind of an eye-opener, like, we can stuff food down way past our satiation point. So what I tell our patients is whenever you're eating anything, eat half your plate, push it away, and just sit back for 5 minutes, have a conversation with whatever, read a book, and then just ask yourself, am I even hungry anymore? And for most people, they're going to say, no, I'm not hungry. So stop eating. Like, just because you can eat the rest of the meal doesn't mean you should, right? So that's one of the interesting thing that I learned a long time ago, that the satiation point, we can eat way past that very easily. And sometimes your brain doesn't kick in like I'm full until you're really stuffed. And that's way past the point of satiation. So
do you know who taught me about leptin resistance
who taught
without knowing he was teaching me that? But
you? Who's that?
that was my father. My
Okay.
father is a child of the Depression. He passed away in at the end of 2020, not from the big C, but he was 92. And he had an 8th grade education. He was a very smart man. And he used to say that a lot of people have their little bell in their brain broken that signals when you are full.
Mm-hmm.
And if you think about it, he didn't know the hormone or the process, but absolutely correct.
Yep.
We don't, either the system is a little broken or we don't pay attention to it.
Correct.
Because there is a point where if you do what you suggest, stop for a moment and think, are you hungry? No? Then stop eating.
Exactly. Yep.
You're satisfied. And satiety is, people are going to eat to satiety usually because that's our normal process. We, hundreds, thousands of years ago, maybe food was not available as often or as much as possible. And the natural way of eating is you eat as much as you can. And I'm sure somewhere along the way, and ultra processed food companies, which is pretty much any food company out there, take advantage of this because
Absolutely.
the foods are manufactured to, hit that bliss point and keep us eating until, we stop because we just couldn't eat anymore, not because we stopped being hungry at some point.
Exactly.
We don't listen to that.
It switches it off, right? The processed foods and everything else. So, yeah.
So, yeah, my father taught me about leptin resistance. He didn't even know the words of the hormonal explanation, but he was right.
Yeah.
All right. So someone's asking about triglycerides and the HDL. Oh, I took it out. There we go. Want to answer this question? What do you think about cholesterol, triglycerides, HDL, LDL, and all this?
Yeah, as far as the percentage dividend on that, I'm not an expert on that math. Obviously, triglycerides should be below 100. HDL should be higher than the LDLs. If you can get like a 60, 70, 80 HDL, that's pretty good. But the cool thing is, though, when you eat the proper foods, these numbers normalize on their own without any medical intervention necessary. You'll have high HDLs, low LDLs. Your triglycerides will be low. Blood sugar will be low. All that's going to happen automatically because they're all connected, as you know, Doc. So it makes it very easy to eat the right way. All of it gets normalized. You don't have to say, I'm going to eat like this just to target my triglycerides. You don't have to do that. There's a way to do it where overall wellness is overall wellness. And, if you have low A1C, low blood sugar, it's pretty hard to have a high triglycerides.
Almost impossible triglycerides.
So, yeah. See what I'm saying? So, and typically it's related to, it's hard to have a low HDL when your blood sugar is normal. So it's all connected. It's good to see the markers, but yeah, it's amazing how people, they overcomplicate this. And that's kind of a problem I've seen in the whole functional medicine space. Even functional medicine doctors can way overcomplicate this. We're going to do hair analysis and saliva testing and stool analysis and scratch testing and all these different things. and come back and say, oh, based on that, you need these 22 different supplements, to try and address
Which I
all
can
of these
provide
things.
for you.
Exactly, right? And oh, by the way, it's going to cost you $1,000 a month, but it's okay, right? It's better than medications. I've seen that so much. So that's what we've spent a lot of time our first 9 years, Doc, of kind of simplifying it down to where, hey, what is a program that's good for literally 95% of type 2 diabetics without overcomplicating it, needing to get $3,000 worth of lab tests to figure it all out? It's a lot simpler than a lot of people want to admit. And I'm one of the first ones to say that, because a lot of people in the functional medicine space, they like making it complicated because then they can charge more for it. Now, whether I should say that or not, I'm just going to let it out there, right? Because I've seen that happen a lot, where they just make it so complicated that then patients become confused. And it's really not that That's why I said, if you eat the right things like we're talking about, your labs start to normalize. Everything gets handled at the same time, which is really nice.
So you mentioned some numbers, and I want to, with those numbers, answer this question, because if you're going to the doctor, if they're doing labs, and you see the triglycerides and the HDL, it's a poor man's way of measuring insulin resistance. It's not perfect. It doesn't do 100%. But if you divide triglycerides by HDL, you mentioned the optimal you're looking for, it's probably under 100, right? And I agree with that. If it's under 75, it's excellent. But at least under 100, and the HDL at least, should be over 50. So if your ratio triglycerides to HDL is under 2, you're unlikely to have still some insulin resistance. By the way, yes, it's possible, but we're not talking about the exceptions, just the majority of the patients. And just the same way, even though it's the exception, might be the 1%, some patients, when they go on a very low carbohydrate diet or carnivore diet, they may have actually persistently high triglycerides. Like I said, those are the exceptions, and sometimes you might have to try to figure that out. But this is a good question. If you have any other questions, please put them in the chat. Let me see. This is a comment, but it's pertinent. Statins didn't appear on the market until 1987. How did the human species ever survive until then?
Exactly.
Without the statins, right?
Well, that goes to my point I said before, right, Doc? When I got out of school, under 250 for cholesterol was normal. Then all of a sudden, magically, I didn't see any research really backing it up. Now it was under 200. So all those people that were between 200 and 250 that were normal are now abnormal, and they needed a statin medication. Wow, right? So, and of course, now we see people, you've probably seen this in your practice, and you're seeing patients. I see people with cholesterols of like 100, and the doctor still has them on statins. And now what's the byproduct? Now they've got low testosterone, because what's one of the main building blocks of cholesterol? It's hormones, right? So we see a lot of men with low testosterone that are taking statins because their cholesterol is way too low, and now their testosterone's low. So then what do the doctors do? They put them on testosterone shots. So it starts this crazy chain reaction I've seen. It's amazing. Low sex drive, etc. And all they got to do is get off the statin meds. Cholesterol comes back up more to a healthy range. Testosterone goes up. Magical, right? It's amazing.
All sex hormones are cholesterol based, cortisol cholesterol based, vitamin D cholesterol based. They all come from cholesterol. And when you're decreasing cholesterol, then you're going to decrease the production of all the other ones that depend on
Well, have you seen too this, Doc? On the statins, there's a black box warning on the statins that says statin drugs increases type 2 diabetes. That's been on there for about 15 years. So that's an interesting thing that a lot of people aren't aware of.
So hello, CV. Yes, they do get vitamin D deficiencies. Okay, so without giving us the secret sauce, tell us more or less what is it that you guys do with a patient comes to you. I have diabetes, and wants your program to take care
Yeah.
of them.
So I'll tell you, I'll start off with just saying what we got patented. So what we got patented is a specific list of foods you can eat and not eat. And that's sort of a combination of between paleo and carnivore. That's kind of what our system is. It's not specifically carnivore, little tweaks to it. I'm sorry, paleo. And then it's our ingredients and dosages of our nutritional supplements. So that's our secret sauce. That's what we got patented. So you ought to eat the way we show you, take our supplements, and there's 87 different nutrients in our supplements. So it's not just cinnamon and chromium and zinc, like a few things, like you see a lot of blood sugar supplements. It's very, very robust. So that's what we got patented. That's what's unique. So again, eat the right foods, take the right supplements. We give exercise recommendations, and then they get one-on-one coaching and support with one of our support coaches to hold them accountable. And they have to check in with their coach at least once a week, letting us know their blood sugar, their blood pressure, and their weight. And they have to send in a daily food log at least once a week so we know what they're eating. And so when they check in and their blood sugar starts gradually coming down, once it gets below about 110 fasting in the morning, that's when the coach says, hey, it's time to call your physician so they can adjust the dose of your meds because it's getting a little bit too low. So we're never diagnosing anybody, prescribing meds, or taking people off of meds. We're just coaching them through our wellness program, and it's their physician that decides when it's appropriate to start weaning them off their medication. So it's really cool. It's a very elegant program we have, and it's been working really well for over 16 years now.
Do you monitor their blood sugars remotely, or
no? They just report themselves either with their own CGM or their glucometer. We have probably about 25% of our patients are wearing the CGMs. But of course, our goal is you reverse the diabetes. You don't need to have that thing stuck on your arm 24/7 anymore, right? You don't need to poke your finger anymore either. So that's the ultimate goal, is to make it where they don't have to do any of that. Then they can just go to their doctor once a year for some blood work. Everything's normal, and they're enjoying their life. That's what we want to have with no meds, per labs. That's the ultimate goal.
do you recommend any particular CGM?
No, I don't.
No.
I mean, they're all pretty much doing the same thing. So again, when they come to us, doc, they're already a diagnosed diabetic. So they're already either, poking their finger every day in the morning with the glucometer, or they already have a CGM. So if they don't have a CGM, we're not recommending they get one, because with our program, their blood sugar is going to come down pretty quickly. So they won't even need the glucometer anymore. So we're not saying, hey, get the CGM for a few months just so it's easier for us to see your numbers. Because I kind of have a sort of a love-hate relationship with the CGMs. I can see the benefits, especially if you're just got diagnosed, you really want to kind of see what you're eating, how it's affecting your blood sugar. But I think for a lot of patients, it makes them more anxious, because now they can check their blood sugar literally every 10 seconds if they want. And it's just like, oh, my blood sugar, what am I doing? And they kind of like, instead of just with us, just take it once in the morning fast. And that's the only number we need. I don't need to see what it is at 3 p.m. or 6 o'clock at night, because if you're eating the way we teach you, your blood sugar is going to stay pretty stable throughout the day. You're not going to have the highs and lows. But if you're not doing our program, I can kind of see the benefits of it, right? So you really get that instant feedback. So, but yeah, our goal is not having to use any of it. That's the whole objective.
I think they're great for monitoring, but like you said, the end goal is to get you off all those things. You just continue eating this way. What other advice do you give them regarding lifestyle?
Yeah, so exercise, we tell them, hey, they should be walking at least 30 minutes a day, 5 days a week. That's the minimum. We don't have them have to join a gym. They can do it on a stationary bike, a treadmill, elliptical machine. just something to kind of get their body moving a little bit. And that tends to be enough because our average age patient, doc, is 65 years old. So that means half of our patients are older than 65. So trying to get them to join a gym and have to go to the gym 3-4 days a week, working out for an hour, it's not going to happen. The compliance goes way down. So luckily for our program, the two biggest drivers of the blood sugar coming down is eating the right foods and taking our supplements. Those are the two. Again, that's our secret sauce. We got patented. So that's it. And then they got to check in once a week. We have a group support call once a week where they can jump on this conference call and hear other diabetics from all over the country sharing success stories, asking questions. That's really cool. And then, of course, they get unlimited support with their support coach to hold them accountable and answer any questions, et cetera, going through the whole program.
You mentioned we were talking about normal ranges of different things, blood sugar and cholesterol were mentioned. And something big happened in 1977 with the food pyramid and the guidelines at the time. All of a sudden, the government is recommending large amount of grains, 6 to 11 servings per day, minimizing meat in all forms, capping. You can't eat cholesterol. Now, we've been eating a lot of fat for thousands of years. All of a sudden, now it's making us sick, right? That was their opinion. So you need to limit that. What do you think about the new guidelines, the upside down pyramid, and
yeah, I think it's better. I'll just say that I think it's better than what it was, but it's still, I think we're both on the same page. More of a combination of keto, paleo, carnivore is more the better way to go for overall benefits. That's what I've seen in my career. So I still think it's a little bit too heavily weighted in the grains and everything else, and a little bit too much in the dairy. But I like it that, there's less sugar in processed foods. Okay. But yeah, I still think it needs some work, but I think it's better than what it was. So that's as far as I'll say.
Well, I think it's an improvement. It's a step forward, and I'd rather stay in the Upper West Side of the new upside down pyramid. Yeah. But they capped the saturated fat still at 10%. There were people in the committee trying to remove that, but some interests still won. And I don't think saturated fat is the problem. It is the sugar.
Yeah, I agree.
All right. So you mentioned you eat twice a day. You restrict the time eating window. Is that part of the recommendations that you also tell your patients as far as restricting the times to eat? And
for us, no. For our program, we don't do that. Again, everyone's got to try their own thing, but with us, we do recommend a breakfast, lunch, dinner, because what I've found over the years, Doc, if you make changes too difficult for somebody, the compliance just plummets to the floor. And so we want to make it where, hey, have breakfast, lunch, and dinner, a couple snacks in between, but it's eating the right kind of food. And again, only eating until you're satisfied versus I want to eat what's on my plate. So those are the things we push really hard. And it's amazing how even doing what we recommend, if somebody has to lose weight, they will in our program, even though we're not a weight loss program. We're a diabetes reversal program. But one of the benefits of eating the right foods is you lose weight if you need to. Amazing how that happens, right? So I just want to make sure that we're very clear that we're not competing with any kind of weight loss company. This is a diabetes reversal program. And any weight loss that happens as a nice benefit, as a side benefit, not as the main goal.
And probably everybody loses some weight. Even though sometimes eating these types of diets, you may find a small percentage that actually may have some weight increase. But the end goal is reversing the diabetes, which is the most damaging condition for anything.
Absolutely.
I mean,
I'll give you an example. Like we've had people that are 100 pounds overweight that join our program that are type 2, They go through our program, reverse their diabetes. They've lost 50 pounds. So they're still 50 pounds overweight, but now their diabetes is reversed. So that's kind of, so you can still be a little bit overweight and have your diabetes reversed. And then if you keep eating the right way over the next 6 months or so, you'll continue to kind of lose some weight and get down to your optimal weight. But that's why we say it's not a weight loss program where like, hey, if you're this, our goal is to get you to lose 40 pounds. And you've seen a lot of physicians where they kind of make that the panacea. If you just lost 50 pounds, all your problems will go away.
Or if you take this pill, you'll never have a stroke.
Yeah. So exactly.
What do you do? What do you do? I mean, you must have this situation. So I'm going to ask you. Patients are having success with your program. They see the numbers getting better. And very often when patients become very interested in reversing their conditions because they learned here or there that you could reverse it, those type of patients very often don't want to take more medicines and want to get off of medicine. So they go to the regular provider, and the provider does let's say a cholesterol test, and your total cholesterol is 201, or your LDL is 130, and you have to take this pill because otherwise you're going to die from a heart attack or stroke. And if you don't take it, two situations happen. Sometimes if you don't take this medicine, the doctor tells them, I have to kick you out of my practice. I think that's unethical personally.
Yep.
But some doctors get upset when they tell the patient, you have this medication, and the patient says, no, thank you. What do you do as far as advising those people, because they might have other problems that they need to continually see a primary care provider?
Yeah. So again, if that happens and there's that resistance, and I just recommend they find another physician. Find one that's got some training in functional medicine, that understands what your goal is. And, in that situation, they might say, hey, you know what? You're kind of on the borderline, but I'm with you. Let's kind of make some more changes in what your lifestyle. Let's come back in a couple months, see what your labs are. If it's improved, great. If it's gotten worse, then we can have a conversation about putting you on some meds temporarily. But that should be the conversation. But if their current physician isn't willing to play ball, then it's time to, again, your doctor is your employee. It's not the other way around. So you can fire your doctor and go find somebody else anytime. And I think a lot of patients don't feel empowered enough to do that. Oh, my doctor says. They have to reverse that paradigm. And especially if they're looking at doing a program like ours or yours, they need to find a doctor who's, on board with that. Hey, I appreciate what you're doing. I respect it. I'm here for you. When your numbers start coming down, I'm more than willing to reduce your meds. That's what kind of doctor you want to have. Not someone who gives you the ultimatum like, hey, if you don't do this, then I'm going to fire you. Like, no. I'm going to fire you. So.
The patient is always in command, but some patients don't even know that.
Correct.
Don't even feel that they can. There have been plenty of times where I may have suggested a medication for something and the patient didn't want it. Okay. It's their decision. It's not mine.
Exactly.
So forcing them to do something, if you don't do it, I'm going to get rid of you. I think that's unethical, because my job is to help them get better and fulfill their goals. Now, I may disagree with the patient's decision, but if they want to do it one way or the other, it's their prerogative, I think.
Hey, they just advise and that's give them consulting, and it's up to the patient to decide what to do. And again, same with us. Like, my goal is let every diabetic in the world know about our program. So at least it's there. Now, whether you decide to do it or not is up to you. But at least I want them to know, hey, there is a way I can reverse this if I choose to. instead of like 95% of diabetics have no clue that type 2 diabetes is reversible. Like no clue. That's one of the biggest things that we hear when people join our program is like, how come my doctor never told me about this? It's because, again, like we talked about, they just weren't trained that it is reversible. So that's what perpetuates this, is that patients don't even know. So let's give them the choice. If you want to take the meds, good. You don't want to take the meds, good. Your choice. But here's both options. That's kind of what we want to share with people. So
I think one of the major problems, unfortunately, is also the advice of entities like the American Diabetes Association, which, by the way, until a few years ago, where they inserted a little statement about low carbohydrate diets, but they still to this day emphasize half your calories come from carbohydrates. Just cover it with your medication, cover it with insulin, and you'll be fine.
Mm-hmm.
What do you think about that?
Again, it's all about management. The American Diabetic Association, their whole program it's basically the same advice you get if you go to one of those hospital classes or like a certified diabetes educator. They're all trained the same way, right? Eat this way, but keep taking your meds, right? That's kind of their game plan. It's never eat like this and you can get off your meds. So that's not part of their vocabulary. It's not part of their teaching or their programs. And that's what's sad, right? So again, so they're trying to, hey, lower your sugars, exercise some more, but it's always keep taking those meds. That's the thing that I don't really agree with, is it's really just a management organization versus, here's some proven solutions to reverse this disease. So
talking about medications, we cannot end this discussion without talking about the big guns out there in the past several years.
Yeah.
Now, the first GLP-1 receptor agonist came out in 2005. Okay, it was Byetta. But let's move forward a few years. I think it was 2017 when Ozempic came out. And of course, it took a few years maybe, but now it's the miracle drugs.
Yeah.
What do you think about those?
Yeah, well, as you know, right, and initially the GLP-1s, right, got approved. I think it was back in, right around the time you said, either 14, 17, got approved as Ozempic for type 2 diabetes. But then what they found was, oh my gosh, people that take it, they also lose weight. So they went back to the FDA and got it approved as a new brand called Wegovy for weight loss. And all Wegovy is just twice the dosage of Ozempic. Same drug, it's a GLP-1. So they just marketed it differently, right? Ozempic for diabetes, Wegovy for weight loss. But now, what do you hear mainly in the marketplace about Ozempic now? It's like Ozempic is the weight loss drug. So you hardly ever hear Wegovy anymore. It's all Ozempic, similar to what in the mid-90s, remember Fen for weight loss. Now, Ozempic is now the weight loss drug of our era right now. But either way, Doc, as you know, whether it's Wegovy, Ozempic, insulin, oral meds, it's just another shortcut to give people the false hope that you don't need to change your lifestyle. Just take this medication, you're good to go. So what I've seen in our program is that we haven't been affected by GLP-1s whatsoever, because anybody who joins our program, they want to get off of all medications, including Ozempic and GLP-1s. So whether it's oral medications, insulin, whether it's lap bands, gastric bypass, any of those shortcuts, those people, that mindset would never do our program, because they are looking for something where they can keep eating what they want and take this medication and still be okay. So that's a completely different mindset than somebody who's like, I want to get off these meds. I'm willing to change my lifestyle. And that's the difference. So I don't know if you've seen the same thing with what you're doing.
Well, I can almost guarantee to those people who want to keep eating the same way, use the shots, because this is going to help me either with the weight or with the blood sugar, which it's ridiculous to think that if you keep eating the way you're eating, which in most people is the main cause of what you're suffering from, that the end result is going to be good, because at some point you're going to get tired of spending $1,000 a month,
Yeah.
and you're going to stop it. And studies are already showing most of the people who lost the weight that way, they either regain back 50 to 80%, only a small amount remain. And, all medications have possible side effects, so
Yeah.
it's never the answer. Now, they're useful tools, okay? And there are people who, after 30 years being diabetic, maybe they now need to use insulin, among other things, because their pancreas got tired of pushing out insulin. I'm in that group. My C peptide is 0.3, basically a type 1 diabetic level. I have no antibodies, by the way, completely. It is type 2 with an exhausted pancreas. But like I said, that is the exception. Most people
Yep.
can reverse their diabetes completely, be without drugs, with a normal A1C or near normal A1C, and they will have reduced the risks. If someone wants to talk to to your diabetes reversal group, where can they find you?
Yeah. Easiest way is just go online. It's diabetesreversalgroup.com. And you can go on there and click on get started, and you can register for one of our free webinars. And that's where they can just watch the webinar, no obligation. And that's how they can learn more about the details of our program and see if it sounds like a right fit for them. So that's the best place to go. Just diabetesreversalgroup.com. There it is.
Okay, diabetesreversalgroup.com. And you can reverse diabetes. There's absolutely no reason you couldn't. Well, unfortunately, I cannot claim that 100% people can reverse it completely, but
Yep.
I mean, those are powerful numbers that I showed before, right?
Yep.
100% of people can get rid of the oral hypoglycemics that I started using when I came out of medical school.
Yep.
Shouldn't be used anymore, because the way they used to work, or they work, is by increasing your insulin production from the pancreas. And most people are dealing with hyperinsulinemia. So what's going to happen?
Exactly.
You're going to get worse eventually.
Yeah.
All right. Let me see if there is any last questions here. We have a couple of. So you've never seen this before, right? In the caves, the cave paintings, usually you see the hunters bringing home
That's right.
their.
That's really good.
We never saw. Well, I still haven't seen it. Those great broccoli paintings, right?
That's hilarious. I love it.
Let's see. This is another comment from Papa Carnivore. Ask your doctor. By the way, he also reversed type 2 diabetes. Ask your doctor what the cavemen and women ate. Ask them if they drew pictures of them eating broccoli, or bread, or was it large animals? Anyways, thank you for being with us today, doctor. Diabetes reversalgroup.com, correct?
Yes, sir.
All right. So
Appreciate
you
it.
can find him there. We also, and we have just about 15 seconds. We'll email you later and have you come to one of our Zoom calls as well within the Kiltz Mighty Tribe community.
Okay. Perfect.
Have a good day, everyone. And today we have at 5:30 one of those Zoom calls. I'll see you later.